Each one will cover 270 households. So how are we doing? There's recently been, and it was presented just a few weeks ago to the Portfolio Committee, a 12-month progress report. And I've just got some of the slides. So there's a green paper, and I believe we have some copies of People's Health Movement response to the green paper in the room. And a white paper is under preparation. So these 11 pilot districts, these 11 domains have been appraised, and I'm not going to show you all of them. It's about management, hospitals, quality, human resources, and so on. So green means nearly or completely achieved, yellow partially, red minimally. So for management, a full-time NHI project manager in these 11 districts, you can see 4 out of 11 so far. Facility improvement team in place, doing quite well, but the overall score for quality is very low if you look at the second bar, and in fact has deteriorated since last year, which is in this slide. I won't show it. The presence of district clinical specialist teams, where there's supposed to be 7 in post, that only 2 have members in a full complement. I'm almost finished anyway. And for human resources, there is a lot of yellow, some green, no red. That's good. And I'll leave that one. So, finally, what are the key challenges? Well, I think there are challenges in partnering with the private sector, in improving governance and accountability, and especially in having enough human resources, both in terms of numbers and competences. And I think Louis will talk about the competences. So the NHI could be a mechanism to redistribute healthcare resources. And People's Health Movement strongly supports a people-centered NHI, but we need to overcome some key challenges. We need to know what's going to be the package of services. We don't know yet. This is under wraps. It's being debated. Secondly, is there going to be sufficient capacity and accountability to administer this very big pool of funds? Thirdly, regulation of the private sector, and of course administration of this whole fund. It's not an easy thing to manage a purchaser-provider arrangement. We need to, in my view and PHM's view, rapidly increase the ratio of community health workers to households. 1 to 270 is insufficient. And in the National Development Plan, there's a proposal, which we smuggled in, to have many, many more, which could create lots more jobs. And finally, we really need to do much, much better with training. We haven't got enough people, they're not in the right places, they're not properly orientated, and if government doesn't invest enough in creating more posts, training more